So, my name is Mark Sujan. By background, I'm a chartered ergonomist, so I will now present a human factors perspective on healthcare AI.
Yeah.
Great. Okay, good. So we just heard there is a big push for AI. It's sold to us as the solution to pretty much all of our problems in the NHS. The reason I've got this here is simply because it sets up an expectation, doesn't it? It's kind of an external pressure almost, and everybody is now feeling under pressure or trying to not feel left out. There's a saying, fear of missing out, there we have it. So you have to use AI. It's a big push. And so we really shouldn't be surprised. You know, if we read stories, for example, there was a survey just recently which suggested already 1 in 5 GPs are using generative AI tools, ChatGPT and similar tools, in their clinical practice. Okay? And so I picked this up. I wrote a little piece on that, and I posted it on LinkedIn as well. And someone from the MHRA commented, well, okay, but you know, this is so-called off-label use. And I thought, okay, that is true, because there is, of course, a disclaimer on ChatGPT and other kind of things. Thou shalt not use it for clinical purposes. But as I mentioned on the previous slide, there's this big expectation. So we're telling people AI will solve the NHS's problem, but at the same time we're saying, but if you use it, then it's probably your own fault if something goes wrong. Overstating it. However, what it doesn't do is, it doesn't tell us what is safe use. Right? So we're kind of left a bit, when I say we, people in the NHS are kind of left a bit to their own devices, and in a vacuum in a way, an uncertainty, what to do. So we need evidence. And of course, so RCTs are now increasing. There is, I think, this paper was published last year or earlier this year, and I think it says on there 86 RCTs, which is good in a way. It's increasing. However, consider how many AI tools there are. Thousands probably, okay? And the number is increasing exponentially. And so we have 86 RCTs now in small areas, right? So that is positive on the one hand, but negative on the other hand because it's quite limited. But also one thing I'm wondering is it depends a bit on what the RCTs are looking at as the endpoints. Often these endpoints are quite narrow in a way, and that is really a problem then, because we already heard about the complexity of healthcare systems and context matters. And so I wanted to mention this because at the professional membership body, which we have for our very small discipline, the Chartered Institute of Ergonomics and Human Factors, we published a white paper, and that's now almost 5 years old. But it just summarizes our observations on healthcare AI, that actually the focus has been very much on the technology. Okay, so it's always about, you know, is the AI as good as a doctor at doing a fairly narrowly defined task? And then, you know, we pride ourselves at achieving, I don't know, 85% of accuracy or something. And don't get me wrong, actually that is great, and I'm all for it, and I don't understand the technology. I'm really in awe of it. I use ChatGPT all the time for all sorts of things. However, you know, the problem really is that it's only one aspect, and ultimately you need to integrate AI into what is a very complex system, right? And so in order to ensure the safety of AI in use, we really need to adopt a systems perspective. And so in the white paper, we just wanted to raise awareness of a number of things that you might also want to consider beyond just the technical capabilities, okay? The impact on people, the impact on a relationship, training requirements, all sorts of things, how people interact. I mean, very nice presentation, Tom, Joe, about, you know, how can we best create interfaces and interaction models. It was quite nice to see, and actually the white paper was taken up with a lot of interest, and people like BSI, for example, incorporated these kind of things in standards as well. And so earlier this month, was it earlier this month?
It was earlier this month.
We published a new guidance document, which was aimed this time more at clinicians, I suppose, or other people who want to deploy AI technologies. And all it does really is it summarizes a few prompts which you might want to consider when you think about whether or not to use AI, or because we have to use AI, how to use AI in a sensible and meaningful way. And so you can see it's just a few elements really that go beyond just the technology. So first of all, what kind of tasks are we looking at? What kind of other technologies are there which might be interacting? What does the organizational environment look like? Or even the physical environment, right? People are talking about AI clutter. Where do we all fit in the new technology and the cables in our really narrow spaces? And that might sound trivial, but often when you look at adverse events, it is just such little things. People not finding sufficient space to plug in computers and these kind of issues, right? And so they have to walk elsewhere, and as they walk elsewhere, they get interrupted, stuff gets forgotten, and it's these things really which create adverse events. Anyway, and so we use a little example from one of our AIP demonstrator projects just to highlight that you want to look at the interactions of different elements of the work system, not just narrowly the task. So the demonstrator was about the use of autonomous infusion pumps in intensive care. So you can see there is a simulated patient there, and they are on lots of different medications given through these infusion pumps. Of course, I don't really know what I'm talking about, not being a clinician, but the issue is that these require frequent changes. And so currently, nurses and other healthcare professionals need to go check up on them and adjust the flow of the medications accordingly. And so the hope is actually when we have autonomous technologies, autonomous infusion pumps, all of this can be done automatically and in a much more responsive way, rather than waiting for an alarm to trigger, for example, and then the nurse needs to find the time. They're always busy, and so there can be delays. So great promise in that technology. But when we interviewed people about, what could be the impact of that, there were really interesting interactions that then surfaced. Okay, I've just two on that slide as an example, because they go beyond just the technology. Right? One thing which I found quite interesting is talking to patients, especially the human interaction is really important, especially in intensive care. Patients were saying, it's such a traumatic experience, you really value the presence of a nurse. And so the argument is, of course, by having autonomous technology, you would have that time. There was that almost infamous saying, giving clinicians back the gift of time. Was it Matt Hancock, I think, who always said, digital technology will give back clinicians the gift of time. But of course, if you take the wider perspective, you can anticipate there are people now saying, okay, we are super busy. We have all this wonderful new AI technology. It will do it for the nurses. Maybe we can have fewer nurses. Or maybe the nurses can have more patients and doing other things as well. Or even maybe nurses can now sit in a central office and monitor what's going on remotely. Okay, is it unrealistic? I don't know. Am I pessimistic? I don't know. But, it could potentially happen. And so rather than having more time with the patient, you actually have fewer interactions with the patient. And the second example is the same, along the same lines. So nurses were saying, when I do the adjustments, I actually don't just do the adjustments. What I really do is I interact with the patient while I do the adjustments. I eyeball the patient, I check in with the patient. And so, just by having this autonomous technology wouldn't actually remove that opportunity, or it would remove the opportunity for that interaction. Okay, so we really need to understand the task, the context, and everything that goes around it, and not just whether the technology can accurately adjust the medication. So that's the key issue here of a systems perspective. And then looking ahead, there are new issues from a systems perspective which we want to look at. Many of these have already been touched upon today. So whether, for example, people become dependent on AI diagnostic systems, whether there is a reinforcement loop, for example, when we now have AI decisions and they are used to train subsequent AI algorithms, that can be quite awkward. It's actually such a long list, I need to remind myself what is on there. Decreased patient-clinician interactions. I mean, that's that conundrum. Do we actually give back the gift of time to clinicians, or do we actually find new tasks for them to do? Because every time we introduce technology into a complex system, the system changes, and we will for sure find new tasks for people as well. There's also something around, reshaping of healthcare roles. Will actually, well, Shakir is still here because we had discussions about that when he was, there. We had, discussions about whether nurses now become something more like AI managers. Is that the new clinical skill? But how are we going to provide that skill? And how do we investigate incidents or adverse event where we have AI technologies involved? How open are technology developers with sharing their data, with sharing details of the algorithms? We discussed this morning, the problem of many hands. It's quite unclear who is responsible. So are developers willing to share all their insights, all their data, if there is not a clear judgment, you are responsible? So are they going to do that proactively? Who owns all the data anyway, right? Which is then collected? Is it still the patient's data? Is it the NHS data? Is it the manufacturer's data? We don't know. All of these things require a much broader, I think, approach rather than looking at performance of algorithms. Right, Kate, I shall hand over to you.
Perfect. Swap places. So yeah, as Marcus said, we need to move kind of from a technological perspective over to more systems or a more human-centered perspective. And to support this, we thought it would be kind of interesting to have a human-centered assurance framework to make sure that AI technology has actually been developed to be human-centered. And to start this process, we wanted to kind of apply this model. So this is originally the Systems Engineering Initiative for Patient Safety 2.0 model, but we've extended it to have AI technology as a separate component because, in fact, it will change how work is done. It will interact with all the other components that are currently in that work system. And to kind of start filling in this framework, to kind of get an understanding of what this framework will contain, we wanted to do a kind of initial overview, a review of the kind of Assuring Autonomy International Programme's demonstrators to understand what interactions have been looked at previously and also to understand the process that went into that and any related outcomes. And we chose the kind of AAIP demonstrators because it gave such a kind of wealth of sectors. As you can see, there's quite a lot going on here, and also different types of kind of AI-related technology. So I kind of include in there autonomous systems, AI technology, and also like robotics as well. And basically, I went through all those 22 demonstrators that I could get the report for and looked for any interactions that they had looked at, so the kind of main interactions within that study, and then the processes that they went to look at those interactions, and then any related outcomes. And then, here's some kind of initial results. I've only kept it to the healthcare ones that were included. As you can see, I found kind of 8 main interactions, and there was quite a wide variety, actually. A lot focus on the kind of interactions between the AI technology and the people within the system. And this is quite common. You see it, it's kind of human-computer interaction, and then, HRI, human-robot interaction. There's a lot of research in this area. Within the healthcare one, but also across all the 22 demonstrators, there was only one that looked at every interaction between the components, and that was the ASSIST project. And funnily enough, they had actually used a system model for that project, so that makes sense. There was others that had looked at kind of interaction between the AI technology and the external environment, and this was around kind of understanding the assurance regulations already in place. And then also, interestingly, and we'll go into more detail on this, there was one that had looked at AI technology and the people within that will be interacting with that technology, but also within that context. They had kind of considered where it would be placed. And here's the example of this. So as you can see, in bold red, you have the kind of interaction between the AI and the person, but it also looked at the kind of context it would be within. So other tools and technologies, the internal environment, people and tasks. And as you can see down here, so the AI technology was a domestic support robot, so it would be placed into a person's home to support that people with their everyday tasks. The people were patients with mild cognitive impairment or early dementia. The tools and technologies would be kind of anything involved with food preparation, whether it be spaghetti or a spoon, and also to support them in any kind of issues that may go on as well. The internal environment was actually a simulated environment, but in a kind of real world use case, it would have been a kitchen or their home, for example. And then the tasks for this specific use case was food preparation. So I do actually believe they helped them make a bowl of spaghetti. So the process that they went to look at these interactions was they developed use case scenarios by understanding their user requirements. And these were then used to kind of test, evaluate, update the kind of robotic system. And then the outcome was basically that there was improvements in the robot's navigation around the kind of home environment, for example, any kind of overcome of hazardous situations, and there was definitely increased collaboration. There was more kind of useful interactions between the person and the robot. But this is just the start, and this is just an initial understanding of the types of interactions that have been looked at, understanding any gaps, understanding all the kind of different approaches that have been taken to look at these interactions, and these will then be hopefully evolve into a kind of human-centered AI framework. And what else we're going to do is a scoping review of the wider literature, which we have started, and this will look at kind of projects that have taken a human-centered perspective for AI, understand again those interactions and any approaches taken. We also want to do consensus work, so what do stakeholders think is most important, always involving the users throughout the process. We'll hopefully then use those things to make a framework, and this will then support in assuring that AI technology has been developed taking this human-centered perspective. And also, as always, it will help develop our kind of research roadmap. So what should we focus on in the future? What's the most important to the people? And really what we're hoping this kind of human-centered AI assurance framework will do is overcome some of the kind of larger challenges that we're facing in this kind of research area. And a lot of them have been discussed today. And, just making sure that they are considered throughout the development. But also considering the vertical integration, because what we do as a community, as human factors practitioners, developers, researchers, and also developers, we interact with other work systems and other people, so regulators, governmental people, and we need to understand how their work systems and what they want and how they interact with the AI technology will impact on the entire work system. So basically, we want to make sure that people, when they're developing AI technology, have considered their wider work system to ensure that it is human-centered. And I think that's everyone. I hope we're out of time, I don't know.